Hello everyone. In the previous section of the larynx, I have discussed about the different cartilage of the larynx. Some cartilage are the paired and some are the unpaired cartilage, and what is the larynx. And in this section, I will discuss about the ligament of the larynx, just like the extrinsic ligament and the intrinsic ligament of the larynx. And also I will discuss about the saccule of the larynx, what is the quadrangular membrane of the larynx, what is the Rima vestibuli and Rima glottidis, and what is the function of the larynx, the nerve supply of the larynx, the blood supply of the larynx, and some clinical aspects associated with the larynx, just like the tracheostomy. In the emergency condition, we do the endotracheal intubation and also do the tracheostomy if the patient does not if there is the obstruction in the larynx, then we do the tracheostomy, emergency tracheostomy, that is the opening in the trachea. Now, what are the ligaments of the larynx? Some ligaments are the extrinsic ligament and some are the intrinsic ligament. What is the extrinsic ligament of the larynx? The thyroid membrane. It is a tough ligament that spans between the superior margin of the thyroid cartilage below and hyoid bone above. Here is the hyoid bone and here is the thyroid cartilage. In between the hyoid bone and the thyroid cartilage, there is the thyroid membrane, and aperture in the lateral part of the thyroid membrane on each side is for the superior laryngeal artery, nerves and lymphatics. Next is the hyoepiglottic. The hyoepiglottic ligament extends from midline of the epiglottis to the body of the hyoid bone. Midline of the epiglottis to the body of the hyoid bone, that is the hyoepiglottic ligament. Next is the cricotracheal. It runs from the lower border of the cricoid cartilage to the upper border of the first tracheal cartilage. The cricotracheal, it runs from the lower border of the cricoid cartilage to the adjacent upper border of the first tracheal cartilage, that is the cricotracheal cartilage. And there is the aperture for the internal branch of the superior laryngeal nerve and artery. There is the thyroid membrane and the two ligament, that is the medial thyroid ligament, and medial thyroid ligament is also present in the larynx, and there is also the cricotracheal ligament. Now, some ligaments are the intrinsic, just like the fibroelastic membrane of the larynx that links together the laryngeal cartilage and completes the architectural framework of the laryngeal cavity, that is the intrinsic ligament. It is composed of the two parts. The two parts are the lower cricothyroid and upper quadrangular membrane. The cricothyroid ligament, it is attached to the arc of the cartilage and extends superiorly to end in a free upper margin within the space enclosed by thyroid cartilage, that is the cricothyroid ligament. It is attached to the cricoid cartilage and extends to end in a free upper margin within the space enclosed by thyroid cartilage. On each side, the free upper margin, the free margin attached anteriorly to the thyroid cartilage and posteriorly to the vocal process of the arytenoid cartilage. The free margin between the two points of attachment is thickened to form vocal ligament, which is under the vocal cord, that is the through vocal cord of the larynx, that is the intrinsic ligament. It is composed of the two parts of lower cricothyroid and upper quadrangular membrane. Now, the free margin between the two points of attachment is thickened to form the vocal ligament. Here is the vocal ligament, the free upper margin of this cricothyroid ligament. This is the cricothyroid ligament, and free upper margin is thickened to form the vocal ligament. Now, how the vestibular ligament is formed? The vestibular ligament is formed by the quadrangular membrane. The quadrangular membrane? This membrane on each side runs between the lateral margin of the epiglottis and the anterolateral surface of the arytenoid cartilage. In this figure, this is the quadrangular membrane. And here is the epiglottis. And this is the quadrangular membrane. Now, each quadrangular membrane has a free upper margin and free lower margin. The free upper margin and the free lower margin. Now, this free lower margin free lower margin. This free lower margin is thickened to form the vestibular ligament. There are the two ligaments. One is the vestibular and second is the vestibular ligament, and second is the there is the vestibular ligament and the vocal ligament. The vestibular ligament and the vocal ligament. That is a quadrangular ligament. Now, the question is why the vestibular ligament it is lateral to the vocal ligament. Why? Vestibular ligament, because the vestibular ligament it is attached to the anterolateral surface of the retinoid. In the retinoid cartilage, I have discussed there is the medial surface and the anterolateral surface. Now, this vestibular ligament it is attached to the anterolateral surface of the retinoid cartilage, and the vocal ligament it is attached to the vocal process of the same cartilage. So the vestibular ligament it is lateral to the vocal ligament. Vestibular, suppose this is the vestibular ligament and this is the vocal ligament. Vestibular ligament and the vocal ligament. This is the vocal ligament, and this lateral is the vestibular. This is the vestibular and this is the vocal ligament. Now this vestibular ligament it is lateral to the vocal ligament because it is attached to the vestibular ligament attached to the anterolateral surface of the retinoid cartilage. Now the cavity of the larynx. We know the cavity of the larynx. Central cavity of the larynx it is tubular in shape, just like the tube-like shape. It is tubular in shape and is lined by the mucosa, and support this architectural support of the larynx it is provided by the fibroelastic membrane of the larynx and by the laryngeal cavity to which it is attached, and the aperture of the cavity opens into the anterior aspect of the pharynx just below the posterior to the tongue. An anterior border is formed by the mucosa covering the superior margin of the epiglottis. That is the cavity of the larynx. Next is the laryngeal joint. That is the cricothyroid joint and cricoarytenoid joint and the synovial joint. Cricothyroid joint it is the synovial joint, and cricoarytenoid that is the ball and socket variety of the joint that have the rotatory movement. That cricoarytenoid joint. The cricoarytenoid joint, the arytenoid cartilage had the rotatory movement, on the cricoid cartilage. That is the cricoarytenoid joint, and these joints are the synovial joint, and it causes the abduction and adduction of the vocal ligament. Now, how the cavity of the larynx is formed? Cavity of the larynx, the lateral border is formed by the airy epiglottic fold. This figure showing the airy epiglottic fold. This is the airy epiglottic fold. Airy epiglottic fold. This is the airy epiglottic fold. Airy epiglottic fold. The lateral border of the laryngeal inlet it is formed by the airy epiglottic fold, and posterior border is formed by the mucosal fold that forms a depression, that is the interarytenoid notch between the two corniculate tubercle. Interarytenoid notch between the two corniculate tubercle, and inferior opening of the laryngeal cavity is continuous with the lumen of the trachea. The lateral border, the posterior border, and the inferior opening of the larynx it is continuous with the lumen of the trachea. This figure again showing the ventricle, the vestibule of the larynx, the laryngeal saccule of the larynx, and the ventricle of the larynx. Laryngeal ventricle. This figure showing also the laryngeal ventricle, the saccule of the larynx, and also there are the three spaces: the supraglottic, the glottic, and the infraglottic space in the larynx. Now, just like the vestibule of the mouth, there is also the vestibule of the larynx. Now, division into the three major regions of the larynx. First is the vestibule, second is the middle chamber, and third is the infraglottic cavity. Vestibule is the upper chamber of the laryngeal inlet, and vestibular fold which encloses the vestibular ligament and associated soft tissue. The middle part of the laryngeal cavity it is thin and is between the vestibular fold above and the vocal fold below. That is the middle part of the laryngeal cavity. And the infraglottic space is the most inferior chamber of the laryngeal cavity and is between the vocal fold and the inferior opening of the larynx. That is the infraglottic space. The vestibule of the larynx, that is the middle chamber, and the infraglottic space, most inferior chamber of the laryngeal cavity and is between the vocal fold and inferior opening of the larynx. Now the ventricle of the larynx and the saccule of the larynx. Ventricle on each side, the mucosa of the middle cavity bulges laterally through the gap between the vestibular and the vocal ligament to produce an expanded trough separated space that is called the laryngeal ventricle. This figure showing the laryngeal ventricle, and from the laryngeal ventricle, this is the laryngeal saccule. This is the saccule of the larynx. This is the laryngeal saccule, and this is the laryngeal ventricle. The laryngeal ventricle and the laryngeal saccule. Now the ventricles of the larynx, the mucosa of the middle cavity bulges laterally through the gap between the vestibular and vocal ligament to produce a expanded space that is called the ventricle, and elongated tubular extension of the each ventricle that projects between the vestibular and thyroid cartilage and may reach as high as top of the thyroid cartilage, that is called the saccule of the larynx. An elongated tubular extension of the ventricle, that is called the saccule of the larynx. And within the saccule क्या होगा? Numerous mucus glands are present and mucus secreted in the saccule that lubricates the vocal fold. That is the laryngeal ventricle and the saccule of the larynx. Now the Rima vestibuli. There are opening in the larynx, that is called the Rima vestibuli and Rima glottidis. What is Rima vestibuli? When viewed from the above, there is the triangular separate opening between the two adjacent vestibular fold. Triangular separate opening between the two adjacent vestibular fold at the entrance of middle chamber of the laryngeal cavity, that is called the Rima vestibuli. And second is the Rima glottidis. Inferior to the vestibular fold, the cover part of the arytenoid cartilage form the lateral wall of a similar but narrower triangular opening, that is called the Rima glottidis, between the two adjacent vocal fold. The triangular opening between the two vocal fold, that is called the Rima glottidis, and in between the opening in between the two vestibular fold, that is called the Rima vestibuli. The Rima vestibuli and the Rima glottidis. This figure showing the Rima vestibuli and the Rima glottidis. Next is the muscles of the larynx. What are the muscles? First is the cricoarytenoid. Second is the posterior cricoarytenoid. It is mainly the abductor of the larynx, and then lateral cricoarytenoid, the transverse, the oblique, the thyroarytenoid, and vocalis. Vocalis produces tension in the vocal cord, and other muscles are the adductor of the larynx, just like the lateral cricoarytenoid, the transverse, the oblique, and the thyroarytenoid, and vocalis that adjust the tension in the larynx. This figure showing the different muscles, that is the transverse, the oblique, the posterior cricoarytenoid, and the lateral cricoarytenoid. Now the function of the larynx. What doing the function? The function of the larynx, that is helps in the respiration, that is in the forced inspiration, and also helps in the phonation, in producing the whispering sound, the sound production and the respiration. Now the clinical. Very important, in the emergency condition, the tracheostomy is done in the trachea, and it is a procedure in which hole is made in the trachea and a tube is inserted. Suppose there is the trachea. In the trachea there is the opening, there will be the production of the opening in this trachea, and a tube is inserted in this trachea. And emergency condition, a tracheostomy is performed when there is the obstruction to the larynx, either due to the inhalation of the foreign body, the severe edema, or secondary to anaphylactic reactions or severe head and neck trauma. That is the tracheostomy. Now what are the blood supply of the larynx? The blood supply of the larynx is by the superior and inferior laryngeal artery, and superior laryngeal artery, which is the branch of the superior thyroid artery derived from the external carotid artery, that is supply the larynx, and it follows the internal branch of the superior laryngeal nerve into the larynx. Second is the inferior laryngeal artery, which is a branch of the inferior thyroid artery and derived from thyrocervical trunk, and it follows the recurrent laryngeal nerve to the larynx. Venous drainage by the superior and inferior laryngeal nerve. Superior and inferior laryngeal nerve. There is the right internal jugular vein, the superior thyroid vein, superior laryngeal vein, and the inferior laryngeal vein. Blood nerve supply. Larynx receives both the motor and sensory innervation via branches of the vagus nerve and recurrent laryngeal nerve that provide sensory innervation to the infraglottic and the motor innervation to the all the internal branches of the muscles of the larynx except cricothyroid. The larynx receives both the motor and sensory innervation via branches of the vagus nerve and recurrent laryngeal nerve that provide the sensory innervation to the infraglottic and motor innervation to the all the internal branches of the larynx. Superior laryngeal nerve provides sensory innervation to the supraglottis and external branch provide the motor innervation to the cricothyroid muscles. That is the superior laryngeal nerve and external branch provide motor innervation to the cricothyroid muscles. That is the thyroid membrane, the cricothyroid muscles, and the right and the left recurrent laryngeal nerve. This is all about the larynx. The larynx has both have the motor supply and also the sensory supply, both motor and sensory by the branches of the vagus nerve, that is the recurrent laryngeal nerve, and the superior laryngeal nerve. Supraglottic part is supplied by the superior laryngeal nerve, and the infraglottic part it is supplied by the recurrent laryngeal nerve, which is the branch of the vagus nerve. This figure also showing the superior thyroid vein and internal jugular vein, the nerve supply of the larynx, and the different blood supply of the larynx. Thank you. This is all about the larynx. Please share, subscribe and like my video. Thank you.